Cancer. The word induces a lot of shock, fear, and even helplessness in people, especially if it is someone known, a friend or a family member. Every year, India observes National Cancer Awareness Day on November 7th to highlight the importance of early detection, prevention, and treatment of cancer. This day serves as a reminder to take proactive steps towards cancer awareness, understand the risk factors, and the importance of timely detection and treatment. I have two very distinguished doctors from Woodlands Hospital on the panel with me. Dr. Rituparna Chaturvedi is a general and laparoscopic surgeon specializing in minimally invasive surgeries, laser surgeries, and breast surgeries. Dr. Prasenjit Chatterjee is a distinguished clinical oncologist with expertise in radiation oncology and chemotherapy. Welcome to a program on National Cancer Awareness. There's a growing instance of cancer cases. In fact, earlier this year, one report has said that India might soon become the cancer capital of the world. My first question is to you both. Has the number of cases really gone up in our country, or are more number of patients getting detected timely and therefore are availing the treatments?
As you asked, you can understand there are so many multifaceted reasons for being increased diagnosis of cancer. Just going back a little bit, if you know our cancer incidence and mortality, definitely the cancer incidence has risen over a period of time. Normally in India, so far as the 2021 Globocon data, 1 million new cases, that is 10 lakhs of new cases is being diagnosed according to 2021. And beyond that, as of current data, we have got 23 cancer consensus data. The number has risen to 1.2 million. That is almost 2 lakhs raised in last 3 years so far as incidence of diagnosis of cancer is concerned. You know, the reason for diagnosis is because of increased awareness of the disease. Of course, the economic well-being and the GDP things, which has worked positively, increased available of logistics and infrastructure available in the country, not only in the urban population, but to the distant rural population as well. And of course, if you say about awareness, it is not the awareness only of the community at large, but it is the medical and the paramedics also. I'll just give you a common example. Even a decade back, patients with symptoms of cough, fever for prolonged 1 month, 2 months used to have empirical tuberculosis treatment. A patient not resolved with antibiotic, the cough and fever, was taken for granted by the chest physician, the qualified skilled pulmonologist, because we didn't have guidelines to start anti-tuberculosis treatment. But by the National Control Tuberculosis Program, we have got recent data where it is being mentioned specifically and categorically, no doctor, whether a physician or a pulmonologist, can start anti-tuberculosis treatment without a positive RT-PCR report. So that makes things easier because we can pick up this lung cancer, which is one of the common cancer in men in India at the moment. To pick up the disease at an earlier stage, we need to do a CT scan. So those are the reasons which is very important. The other thing which is also important is, since cancer is a big non-communicable disease, at the same time we don't have a screening program compulsory in India. I'll come to the screening, or we can discuss at length about screening. But if that's what we are doing, high risk population, people with a family history of cancer, an individual with positive family history or some predisposing risk factors, if they are evaluated, they can be picked up for cancer at an early stage.
Absolutely. Because the screening has become more evident and people has become aware of this cancer symptoms. That's why the incident, like, since we are picking up more cases, so the incidence also is like overall incidence also has increased, and the number of cancer cases also has increased in India. And that's because mostly there is so much of pollution. We are breathing and eating and inhaling everything, all carcinogens. So eating healthy and exercising is a important factor to prevent cancer.
So actually,
A
yes, please.
corollary to Dr. Chaturvedi, what she's saying, a bit about screening, we all know, is looking for cancers much before the symptoms arise, right? It is called screening. Of course, it's a very powerful strategy for prevention, early detection, and better management. But having said that, we have now, whatever we talk, we have to talk back on the evidence. The National Family Health and Welfare Survey 5, which was conducted between 2019 and 2021, was reported in 2024, this very year. Now, this Family Health National Family Welfare 5 program says that they are a rural and versus urban population screening. But to utter dismay, I just want to just point out the common cancers is in women is cervix cancer, breast cancer, and oral cancer. And in men, it is head and neck, that is oral and the larynx cancer. So it has been seen that around 2% of the patients with cervix cancer, which is still a common cancer among the rural population or population with a lower socioeconomic strata, 2% of the patients underwent screening program of the huge screening program which was taken up by the government of India under the name of National Family Welfare. And the other cancers I was talking about, that is the breast and the oral cavity, it's mere 1% of the population went for screening. So screening is certainly a powerful tool if it had been utilized in a proper way. Unfortunately, because of the huge burden of population in India, screening is not a successful program. So we have to individualize and customize how best we can do. And that is what, when we expertise or oncologists feel that a high risk patient or the family members or in the neighborhood or in some occupational workers, we do some type of screening to pick up the disease in an early stage. Hence, they can be treated and given a curative option of treatment.
Right. So Dr. Chaturvedi very briefly talked about the pollution and what we eat and what we breathe. And we often hear that cancer may have link with one's diet and lifestyle. So, Dr. Chatterjee, what is your opinion on this?
Yeah, certainly they are the lifestyle diseases. As you know, the non-communicable diseases like the cardiovascular disease, stroke, diabetes, and cancer, they fall under one category which is called non-communicable disease. Now, still, cancer is the second common cause of India at present moment, going by the mortality registry so far as available in India. Now the problem is because it's a non-communicable disease, we don't pick up the disease at an early stage. Certainly, it rests upon the risk factors, which are modifiable risk factors, as well as the unmodified risk factors. Now, what you mean by unmodified risk factors is genetic or familial preponderance. Suppose your mother, sister, cousin, auntie have a breast cancer or an uterus cancer, there is a propensity or chance that the next online in the sibling can have either breast, ovary, or uterus cancer. So this is called genetic preponderance. So it's a handful of 15 to 20% of them are genetic preponderance. Majority of them are lifestyle based, which are called modifiable factors. Hence, it is called, this cancer is also called a lifestyle disease. So essentially, it falls under, as Dr. Chaturvedi said, upon risk factors which are modifiable risk factors, and the other one is the environmental exposure, as he said. So modifiable risk factors essentially include smoking. Smoking is still big number 1 to 10 cause of many cancers, which include the oral cancer, larynx cancer, as well as the lung cancer. Other are sedentary lifestyle, that is very important. How much exercise or brisk walking you are doing, so that is restful of life has a more propensity for developing of different types of cancer besides other non-communicable diseases like cardiovascular diseases and diabetes, as we mentioned earlier. So those two are very important factors. Of course, exposure to sun is also important. There are a lot of carcinogens available in the atmosphere, which can be the result of few cancers. Occupational workers, people working in an asbestos factory, they are more prone to some cancers called mesothelioma. That's a lung cancer. It's that group. Again, alcohol intake can have a liability of many cancers like bladder cancer, breast cancer, kidney cancers. So, a conglomeration of factors which are modified, which we call as lifestyle disease factors, has lot of bearing to the extent 80%, which can be the reason for accelerating the process of carcinogenesis.
And is food or one's diet?
Yes, diet is another important thing which has been talked about. I think New York Times has done a study in 2020, 4 years back, about diet and cancer. And you won't believe it. I give it much of my talks about this diet and cancer. There were 1.6 million hits on Google regarding diet and cancer. What I'm trying to say, it's not only information, but it is information overload. We go by the old saying, an apple a day keeps the doctor away, right? So a lot of information is available about diet. So at the end of the day, general people are confused what is right and what is wrong, how much to take and how much not to take. Having said that, plenty of vegetables and fruits are certainly very, very, very good. So you should have at least two servings of fruits and two servings of vegetables in a day, and less of animal fat is something where we can balance about so far as the diet is concerned, to prevent not only from cancer but other diseases as well.
Stress is considered. Yes, please.
I just want to just give a tagline that yes, obesity does give rise to cancer. So try to eat a healthy food and do what sir said, that 45 minutes of brisk walking or exercise. If we incorporate this in our lifestyle, then that will at least prevent from our side. We can do all this, and also cooking in this Teflon coated utensils is also, they are saying that that has a lot of carcinogen, and avoid using plastic containers and to carry food and all. So better to go for glass, or even cook in iron pots and all, earthenware as before. So these are few steps which we can do to prevent intake of carcinogens in our daily life.
What about stress? So while talking about lifestyle, stress is a big part of our lifestyle today.
Absolutely.
So does it have any direct correlation?
Stress, emotional quotient. Yes, there are studies where they have said that depression and anxiety and stress does give rise to cancer. Sir, what do you say? Like, I have read articles saying that there is direct evidence of
Yeah,
people.
definitely that as an additive or rather a complementary parameter. So that may not be the direct parameter or an antidote for treatment of cancer, but certainly meditation, yoga, a little bit of music, whatever one. If you can walk and talk with your dog while you're on a walk, that also gives a lot of release of stress. So it is very much individualized how you can distress and detox yourself. I mean, in this world of social networking site, you can always have a detox by logging off your computer for, say, 1 week or maybe 2 days for that matter. I don't know how Saumyapriya will accept that with me, because in today's world, you are not checking your email every hour. That makes that you are not fit for the corporate world. So I think we have to have a striking balance how we can stress it. In fact, I would always recommend a parameter, rather, I use the word nurse, it's a mnemonic, NURSE, when dealing with each patient. Like, it is very important, when you address a patient or when you call a patient in your office, you just don't say, hey, 4 number patient ta pathiye de, please send number 4 patient. Rather, you address the patient, saying, hi, Mr. Robin Pal, please come and take your seat. So this naming the patient is very important. Understanding the patient is also important. A small touch, gentle touch or pat on the shoulder, is some way as a not only medics but paramedics also. We also take classes amongst our nurses and paramedics also. Helps in understanding the patient well, respecting a patient. So if Robin Pal is a professor, you address him by Professor Pal. How are you today? So that is small things, but it matters a lot, and it boosts the confidence of the patient and the family members to comply with the treatment. So these are small things, and the S is very important. You were talking about that is support. Support is different forms of support. We actually cannot define by one word so far as support is concerned. In fact, it's a conglomeration, or rather, it's a spectrum of paramedical, financial, psychosocial, and alternative treatment. What we are talking about, meditation and yoga, which as a spectrum helps the patient to cope with the treatment, better cope with the treatment. Patient is always in a state of denial. Breaking the news is a very difficult task for both an oncologist or sometimes a psychiatrist when dealing with a patient of a psychiatrist. So, how do you do that is certainly a different topic. We will not get into that. But coping with the patient is how you interact with the patient, how much empathetic you are with the patient. And here, support plays an immense role, how you get a patient's confidence and come to terms with the disease, and hence to take the treatment in a better compliant way. So that makes very important thing. Of course, the other issues like financial issues, the psychosocial issues, counseling is very important. Majority of the patients we don't pay much heed. We are in a worry to see 20 patients in a 2 hour span of time, but I think 70 to 80% of the patient needs a bit of counseling, a word of empathy. They want to hear from you. How many, where do you stay? How many family members are there in you? Or how many of you were you working? Or are you staying in a village? Different types of parameters helps you address the situation and get pally with the patient to draw his or her confidence. That is an important way how we can deal and get a support from the patient.
I think, Doctor, what you're essentially talking about with this term nurse is a human connection, creating a human connection and having a good work-life balance overall, which is very important for our well-being. And now coming to cancers, particularly in women, Dr. Chaturvedi, what are some of the signs and symptoms that one needs to be vigilant about? Because we often hear that early detection is, what probably at times, decides how the case is going to, progress.
Yes. Yes, early detection is very important because only when we detect at an early stage that we can cure cancer. I will just tell about first breast cancer. Like what we say that if you have detected a small lump in the breast or any discharge from the nipple, mainly blood stain discharge, or if you see lump in the armpit, axilla, we say, even that is quite a warning sign because most of the lymph nodes draining the breast is in the axilla. So, and we tell that self breast examination is very important, and that is every month after the fourth day of menstrual cycle, that periods which we say, you should a girl should with the palm of the hand on a circular motion uh, check all the quadrants of the breast to see if there is any abnormal lump present in the area, and if she detects something like that, she should always go to a doctor, get it checked, get further investigated further so that we can detect if it is a cancer or any other type of tumor, and we can start with the treatment early because breast cancer treatment has advanced a lot. I think Dr. Chatterjee should endorse that nowadays we can very easily cure breast cancer. So awareness and early detection and reporting to a proper doctor is very important so that we don't lose time. That is breast cancer. And again, breast cancer, there are certain risk factors as we have already said, obesity, drinking alcohol, smoking, all these are big risk factors which are modifiable. There are certain non-modifiable, as sir said, that genetic predisposition and all that is there, which we cannot age, we cannot reverse, we cannot, it is not in our hand. So that is non-modifiable. But eating healthy, exercising, avoiding obesity, and not having alcohol and stop smoking, these are in our hand. So we at least can do that. And if we detect anything, or any skin changes in the breast, that also is an alarming sign of cancer. Then coming to cervical cancer or endometrial cancer, in cervical cancer also is like prevention is there. We can go for HPV vaccination. Like 9% of the cervical cancers are due to this human papilloma virus. So from the pre-pubertal age group, girls, even boys, they over certain in some countries, like developed countries, they are giving this anti-HPV vaccine to both males and females at the age group of 9 to 14 years. So that can prevent cervical cancer. Then multiple sexual partners, if you avoid that, a safe sex can save you from cervical cancer. And alarming sign is that if you get blood-stained discharge, or for endometrial cancer, heavy bleeding, intermenstrual bleeding, in between there is bleeding. And of course, age is also a factor. And any history of uterine or endometrial cancer, or breast cancer, or prostate cancer in the family also can give rise to this kind of cancer. So those are the high risk group where we can do frequent screening. So for breast cancer, the screening is, if for younger patients, it's a high resolution ultrasound scan. And for the elderly population, like above 35 to 40 years of age group, we do mammography test. Every 3 yearly it is recommended. And in high risk group, obviously every yearly checkup is recommended. And for cervical cancer, we can do pap smear test to find out. So these are the few things which I would emphasize that
Tests available for ovarian cancers.
yes, there are certain markers which are there. Like ovarian cancer, generally we get patient come to us with lump in lower abdomen or lower abdomen pain, or any difficulty in urinating. But as sir would say, ovarian cancers we get at a very few cases we get at an early stage. What do you say, sir? Ovarian cancer?
Yeah, ovarian cancer is called a matter of chance diagnosis.
Yes.
This was the picture even 4 decades back. As of today, it is the same. The reason is ovaries are very small structures, 3 to 3 centimeter size on either side of the uterus, right? So what happens is when there is a tumor happening in ovary in early stage, like stage 1 and stage 2, and since we don't have a robust screening program, we don't pick up ovarian cancer in stage 1 and stage 2, which is essentially an early cancer. Majority of the patients usually presents with abdominal distension, that is fluid in the abdomen, we call it ascites, or dyspepsia, that is a problem of regurgitation, acidity, something. And when you evaluate these patients, women with 40 years plus age, then you do a CT scan when you don't find something in an ultrasound because there may be a cyst in the ovary or there's an adnexal swelling, which is not very specific for CA ovary. And we also had, as Dr. Chaturvedi said, a tumor marker called CA125, simple blood test, and it is sensitive in 80% of the situations. CA125 tumor marker blood is raised in 80% of the women who are diagnosed with ovarian cancer. So that may be one way where we can pick up, but that is essentially in locally advanced stage. In stage 1 and stage 2, since we don't do a routine CT scan, low dose CT scan, what is done in the Western countries to pick up disease in the early stage, we miss out an early stage. Now, having said that, I will just like to point out one encouraging evidence what has happened. Like there was a 10 years data from 2010 to 2015 and 2015 to 2020, and it has been seen that early stage cancer is stage 1, stage 2, as I told you, and advanced is stage 3, stage 4. So to say that we have been seeing in 2015 to 20 the cancer registry data that 20% of the cancers are downstaged at diagnosis, who are being diagnosed from 2015 to 2020 versus those who are diagnosed in 2010 to 2014. What I want to say, because of increased awareness, increased available of infrastructure and logistics, we can pick up the disease at an early stage, and that is being documented in the cancer registry, and we have been having the data. We have been sharing it with our paramedics and other community at large. So it certainly goes without saying that increased awareness, increased evaluation of a patient, especially in the high risk group, can diagnose patient in an early stage. And as Dr. Chaturvedi said, picking up disease in early stage has a curable potential. So we should always see how we can pick up the disease in an early stage, and that is happening in India is the good news.
And that is why awareness is so much important. Though government from their side as well as corporate hospitals are doing their bit, but the sad part is, sir, that till today I get patients who with a breast cancer or a breast lump is getting treated for 6 months, 8 months at a homeopathy doctor and coming to us at a very late stage. I feel sad for them because breast cancer has a very good prognosis if detected early, and I think
The women still in our country, the rural population has that we will not disclose the disease, the whole family will be in the topsy-turvy, the financial situation of the house is not so good, visiting an hospital means incurring expenses, so they carry the disease for a period of
Factor,
time
I think.
than
I think
6 to 9 months.
people want to deny their, they have their so much fear around cancer that they don't even want to probably come to the doctors to get treated or to even get diagnosed. So, sir, you mentioned about CT scans, but in India, usually ultrasonography is done, the USG of the abdomen as a routine test. So, is it not enough to be able to detect ovarian cancer in a early stage?
No, not always. If you find something suspicious in an ultrasound, then you do follow it up with a CT scan, because CT scan has a 2 millimeter slice, so it can detect, it has a high resolution, so it can detect or differentiate between a solid and a cystic lesion, because solid lesions are essentially more cancerous, cystic lesions are more non-cancerous, or it's a cystic type. Moreover, it can comment about the omentum, the layer of the abdomen, which also gets involved in ovarian cancer, as well as the lymph nodes. So they cannot be picked up better with the ultrasound. So if there is something suspicious, we go ahead and do a CT scan. But what I was saying about is a low dose CT scan, that is for a routine screening program, because CT scan has its own limitation. It emits radiation, so we have an exposure of radiation, which itself over the years, if you do a repeat CT scan every year, so you get lot of exposure to radiation, which itself has not only carcinogen. You can have a cancer in later years because of excessive use of radiation or exposure to radiation. So low dose CT scan is a special type of CT scan machine which emits lesser dose of radiation, which is used as a screening tool for picking of cancers like lung cancer, ovarian cancer, which are the common cancers in women and men.
So, we spoke quite a bit about cancer in women, the ovarian, cervical, and the breast cancer. What about the cancers in men? Like, I think the most common is, as you mentioned, lung cancer as well as prostate cancer, which is. So, are there any signs and symptoms that are often overlooked?
See, as of now, still head and neck cancer is the commonest cancer in male in India. Now, head and neck cancer is a big conglomeration. It includes the oral cavity, it includes the pharynx, it includes the larynx, it includes the nasopharynx also. So, on the whole, head and neck cancer is the commonest, of which oral cavity, because of exposure to tobacco, especially chewing tobacco, it's a huge problem in our country, is the cause, followed with lung cancer. Lung cancer is creeping up in a big way, especially in the urban population, because of not only active smoking, but because of passive exposure to the environmental carcinogens also. So I think the small way of helping it is using a mask. In fact, the COVID has taught us how masks can be helpful. So I think it is very important people who are prone to exposures and allergies, or going to a crowded places, or with a heavy traffic area, they use a mask that helps in cutting down to exposure of carcinogens in a big way, because lung cancer is creeping up in a big way so far as the incidence of cancer. Now, again, the prostate cancer was never a problem in the lower income group population like India. Was the problem of the Western countries. But you'll be surprised to know I am working in a corporate hospitals. I am seeing average 5 to 7 new prostate cancer patients every month. So prostate cancer is slowly creeping up the stairs so far as incidence of cancer is concerned. The main reason for that, can you guess it? What is the reason?
Early detection.
No, the main reason is increased life expectancy.
Yes.
When we were studying medical science, the average life expectancy was 66 years. And currently, the average life expectancy in India is 76 years. The meaning of average life expectancy of the 1.4 billion population India has, average person lives for 76 years in India, irrespective of gender. So that is a huge development feat of science which has happened in this part of the world, and we have to accept that. Because people are living more, the reason is because they remain cured, and life expectancy is increased in last 20 years from my medical days, graduation days till today, by 10 years. So it was 66 years average life expectancy in early 2000 versus it is 76 years today. So a person or an individual who lives for more period of time, prostate cancer is essentially a geriatric disease. It usually occurs after the age of 60 years. So more number of people living more than 60 years, the higher chance of developing prostate cancer. So that is what the simple explanation is.
Absolutely. Prostate cancer is a geriatric population cancer.
But it's treatable. It's one of the treatable forms.
Very good prognosis of prostate cancer.
Yes, yes.
Now, in the beginning of a conversation, you briefly mentioned about the genetic factor. You did say that about 15% would be because of genetics. But people with a family history, would you recommend a genetic screening tests done, which are available now?
For breast cancers, yes, we do genetic screening of BRCA1 and BRCA2 gene screening, and for those patients who are positive with BRCA1 or BRCA2, they are more prone for ovarian cancer as well, and we do keep them under surveillance, means very frequent screening tests. And as we were talking yesterday, would you like to name her?
Yes, I was actually, while I was conversing with her, I asked about the case of Angelina Jolie, which we all read in the news a few years back, that she tested positive for
Yes.
this, and then she went for a mastectomy. So,
Mastectomy, yes.
is
That is
that a
called
recommended action?
prophylactic mastectomy. Means before you get the disease, you remove the organ itself.
Right.
So that option can be given to the patient, but into like in our country, many of them will not be as bold as Miss Jolie, and but then obviously, if we keep them under surveillance, we can pick up the cancer very early. And another screening for such sensitive, high risk patients is MRI of the breast, so that we can pick up at a very early stage. A very small lesion can be detected. Sir, you want to add something?
Yes.
Yeah, you picked up and speak about the UN ambassador. Yeah, she is a celebrity not only as a Hollywood actress as well as UN ambassador. Now, what happened? I think most of you know the full story. It was in 2013 or 14 that there was a huge uproar all over the globally uproar and lot of discussions for and against what she opted for, because at that point of time in early 2010 onwards, we didn't have the guidelines for. And what Dr. Chaturvedi said, she underwent not only mastectomy, she underwent a prophylactic double mastectomy. I repeat, prophylactic double mastectomy. Her mother was a breast cancer patient, her sister was a ovarian cancer patient, and she tested positive for BRCA1. So she had a 60% chance of developing either a breast cancer or ovarian cancer in next 5 years time. Try to understand the risk stratification. So in those days, 2013, 14, we really didn't have any guidelines, not only in this part of the world, but also in the Western world, what should be the treatment options. So this is actually an adaptive surgery, what we call adaptive surgery. So we didn't have the guidelines. So she discussed with lot of doctors in North America, Europe, as well as other parts of the world, breast specialists. So few of them advised about her this preventive double mastectomy treatment, and ultimately she took the decision because it was an option given to her, and she took the decision of undergoing the surgery considering the risk involved. So having said those points and perspectives, we today have the guideline. Today there is no doubt, there will be no uproar, there will be no hue and cry if somebody accepts this as a treatment or preventive treatment for that matter. Those days there was no guidelines, so there was a lot of discussion and uproar. But today this is an accepted terminology, and it is being done also in India.
So, talking about the modern methods of cancer treatment, so I'm sure things are much advanced now, as you mentioned, and there are research and development going on all the time in this area. So, Dr. Chatterjee, what are some of the latest treatment options or innovations in oncology that would help in better management of cancer?
Yeah, I'm proud to say, being a doctor from Woodlands, the Woodlands Hospital will soon be a proud owner or a host of a cancer setup. It will have a dedicated, modern, high energy linear accelerator. That is the treatment for radiotherapy. That's a very sophisticated, precision, focused treatment where you can see the image and direct the radiation beam. So far as like the technology has advanced so much, like for a lung cancer, normally a person breathes in and breathes out, right? Little bit of movement happen every second as we breathe in and breathe out. And this modern adaptive radiotherapy, what we are going to have in our center, also can take care about this motion of breathing in and breathing out and hitting the target, that is the tumor in the lung. Sometimes a tumor in the prostate we were discussing, it's also very difficult to precisely treat, because it is the prostate is a betel nut like gland in a male population in the pelvis between the urinary bladder and the rectum. Now the problem is the urinary bladder is always filled with some amount of urine, which varies from morning 8 a.m. to 8 p.m. in the evening, and again the rectum is loaded with some amount of stool. Again, that loading of rectum is also very differential and dynamic from time to time. So giving radiation every day for 5 days a week, for 2 weeks or 10 weeks becomes difficult because every day you cannot treat the same prostate because of the differential and dynamic position of the urinary bladder and the rectum. This modern radiotherapy machine, what we are going to have, will take care about this differential swelling of the bladder and the rectum and hit the prostate targeted way in a very precision. So these are the things which also helps in treating in a very positive precision way and saving the normal adjoining tissues, which are very important. You don't want to treat the bladder and the rectum while treating the prostate, right? You don't want to treat the heart when you're treating a tumor in the left lung. So these are very important and technical things which we help with the radiologist and the physicist do a dose optimization and treat the patients in these machines, taking care about the motion also.
That's
We also have
really
some modern treatments which we have done in Woodlands. I think Dr. Chaturvedi will know some treatments which you can do only in breast cancer with subcutaneous injections. You don't need to admit a patient of a breast cancer after the surgery for chemotherapy. So it is a subcutaneous injection you give in the lower end of the thigh, in the subcutaneous tissue. It's a 8 to 15 minutes small injection you can give in the daycare or rather in the OPD only. You don't need to admit the patient. Patient saves time not getting admitted. The hospital saves time in not using up the infrastructure, and the patient gets breast cancer patient gets treatment. Some other problems for breast cancer patients, like normally for a breast cancer in the right side, you cannot use the right arm. That's what Dr. Chaturvedi will endorse me. So you have only the left arm and the left forearm to use the veins for giving repeated chemotherapy for 6 to 8 cycles, or maybe more if you have to give other injections. So that becomes a problem. And before the chemo and after the chemo, you have to give the blood for a test, because we know we do a blood test because of anticipated bone marrow depression. The blood counts decrease, right? So nowadays we don't do a repeated pricking of vein every time you go to the hospital and
Left
get ready for a
bones.
chemotherapy. Yeah, you use it. The surgeon does a chemo port while he or she is operating on her breast. So you do a chemo port, and it's a simple thing. You just put the cannula in the chemo port, and the patient gets treatment. So every time patient is not going through that uncomfortable task of getting repeatedly pricked by the nurse and the doctors to get a vein, and those veins become very bad, and they remain bad for 6 months before they recanalize again. So these are the techniques we routinely do in our hospital also, and I think these modern techniques talks much about quality of life. Today, in dealing with a cancer patient, we not only talk about the time period we give to the patient, but
Also improve the mortality.
quality time we give to the patient. What quality of life you give to the patient is the denominator you should respect when you are taking a patient for a treatment and discussing the algorithm with the patient and the family.
Absolutely.
absolutely. Yes,
Absolutely.
that's
And
very heartening to hear. Yes, I'm coming to you, Dr. Chaturvedi. I would like to know about uh, the advancements in surgeries that are available now.
yes,
So,
in breast cancer also, like previously, a very radical operation used to be done, like removing the whole breast along with the axillary lymph nodes, the glands, which are positive. But with time and with support of our oncologists, that like giving chemotherapy, downstaging the disease, and removing or not removing the whole breast, because that gives a psychological impact on a for a girl. It is very difficult to part with the whole breast. So nowadays, after lot of studies, they have seen that removing only the lump, the tumor, along with a little bit of surrounding tissue, is enough to cure the disease. So for those, that is called breast conservation surgery. So after breast conservation surgery, we have to discuss with the patient that if you want to keep the breast, then you have to go mandatory to go for radiation as well as chemotherapy. And as sir said rightly, that multiple number of pricking becomes really very difficult for the patient every month picking it. So we generally counsel the patient during the initial surgery itself that we will place a port in the subcutaneous tissue from where directly blood can be withdrawn, also chemotherapy can be given. So that becomes very comfortable for the patient later on. And as you are asking about advancement, so I will, though we do not give, Dr. Chatterjee gives such kind of therapies, but yes, there are a lot of advancement on targeted therapy that we call monoclonal antibodies. So that is a big advancement in cancer treatment, and that also increases the life lifespan of the patient. Like even in advanced cases, these kind of chemotherapeutic agents are used. So a lot of advancement has happened over the years, and now I think more people are living with the disease or getting cured of cancer than dying with the disease. And I hope with our awareness programs, people will come forward more often and get themselves treated at an early stage so that we can give a good result. The whole oncology team can give a, like the surgeons, the oncologists, all together we can go hand in hand and give a better life to those kind of patients. And nowadays robotics also is in play, is available, and I hope Woodlands is coming with a robotic machine also. And robotics also has a lot of role to play in cancer treatment, especially those pelvic cancers, ovarian cancers, prostate cancers, because mostly the advantage is that it is more specific, very fine movements can be done by the robot, and good amount of tissue with a lot of precision can be taken out, especially in cancer treatment.
I
You
think,
Sir,
can discharge the patient next day.
that's a very heartening message from you. And my final question to Dr. Chatterjee. So, what would be your message for our viewers on National Cancer Awareness Day?
I think it is a very, very narrow balance of life, which is very important. Like, I cannot recommend or advise anybody, maybe my friends or neighborhood, that these are all my guidelines so far as exercise is concerned, diet is concerned, no to alcohol is concerned. That makes life very, very difficult. So, striking a very balanced life is most important. I think a small amount or measured amount of everything in the right direction will give you a path. Actually, in this fast living world where the majority of us are hooked to the social networking site, sedentary lifestyle, speed of daily life, I think one should have time to stop, look back, rewind, and I think the answer lies within us.
It's wonderful. What about you? Any message for our viewers, Dr. Chaturvedi?
as Dr. Chatterjee has rightly said, that striking a balance is very important. To have a balanced diet, to exercise daily, and to keep ourselves fit, and of course, being aware of the disease. And if any of these alarming signs are or symptoms are present, please go to a proper doctor, get yourself checked, and get early treatment.
Thank you so much, Dr. Chatterjee and Dr. Chaturvedi, for the invaluable insights that you have shared with us. And I'm sure it will be of immense help for our viewers in generating awareness and understanding the modern treatment options that are available today. Thank you so much for sharing your time and knowledge with us.
Thank you, Saumyapriya. And I want to thank Woodlands team for inviting us for this wonderful program. Thank you.